Alright, so Assalamualaikum and good morning. We see again on our next class. Alright, so without wasting any more time, today we proceed with the next lesson, which is the basic injury management. So last week we learned about the basics injuries and the common injuries that occurs during our daily life. Right. So now we learn on how to prevent or how to treat the injuries. Alright. So the first one, the simple one, the common one, which is the VICE treatment. Alright. So VICE it usually used if the chronic is acute. So acute means it's not something that's serious. Alright. So VICE, what it stands for? So VICE, I stand for rest. I for ice, C for compression, and E for elevation. And usually, VICE will be used after the injury is 72 hours long. If it more than that, it will assume as the chronic injuries. All right. So the first one, I'm sorry. Right, the first one, yes, rest. So this purpose of the rest is to reduce activity and allow our muscle or the injured area to recover. Ice to reduce the pain or the swelling of the injured area. Compress to minimize the swelling and allow the blood flow to flow smoothly to our body. And the last one is the elevation, which is to elevate the blood to reach our heart. All right. So the first one we goes more specifics the rest, right? So rest are usually be suggested by the doctor after you've been diagnosed with the injuries. What usually the athlete that suffer the injury will have to rest because we want to reduce the risk of for more serious injury and also to increase the speed of recovery process. Right. Usually, when we rest, it means that we cannot do any activity that can damage our injured area. For example, if you guys injured on your left shoulder, please avoid any movement that can cause injuries to your shoulder. All right. So it's actually it's similar with when you work out or when you exercise. Usually, when you this is common in for people in Malaysia. Usually, when they feel do not feel pain in your body when they exercise, they assume they will not receive any benefit from the exercise, but it's actually not. If you feel pain in your body, all right, this is actually a signal for you to stop, all right, because there is something wrong when you feel pain when you do the exercise. So please, if you hurt yourself doing exercise, please have a rest for minimum maybe 3 days, and then if after 3 days the rest maybe, I'm sorry, after 3 days, maybe the injury is not um, going the recovery going smoothly and still feel pain after the 3 day rest, please go to see the doctor. It means that your injury is serious. So the next one is the ice treatment. Yes, this is the best part, right? The ice treatment. So ice is actually the initial treatment that used for the acute injury, and the ice must be cold. Alright. So actually, cold promote vasoconstriction, thus controlling the bleeding and edema. So vasoconstriction is allowed to reduce the swelling area. So when our muscles swelling, for example here, right? So when we're swelling, if you touch the swelling area, it actually feel a little bit hot, right? A little bit sense of heat when our muscle swelling. It means that the blood gather at the swelling area. So when we apply the ice on the injured area, all right, so it actually help to reduce the heat, and then the swelling will actually reduce as days go by. Right. So usually when you want to apply the ice, it's recommended to apply, not put the ice directly on the skin because it can actually lead to frostbite, which is a serious injury. But please, before you apply the ice on your injured area, please cover with something or put the ice inside the plastic bag and apply it on your skin. Okay, so usually it recommended to do the ice treatment maybe for 15 minutes or 20 minutes. But if you do longer than that, maybe for 1 hour, yes, you can have a frostbite, which is absolutely painful. All right, I hope you guys clear on this part. So the next part, yes, the compression part. Yes, usually we compress the injured area with a form maybe of bandage to reduce the bleeding and also minimize the swelling information. Alright, the fluid leakage into the interstitial space is related by the compression and absorption is facilitated. All right, this compression should be applied both during and after the ice application. Yes, so compression, we compress the injured area, okay, because we want to reduce, of course, the bleeding. So just imagine if you bleed your maybe your forearm. um, if you do not compress your forearm, yes, the blood will keep flow up and you will lose a lot of blood. So by compressing it, it put the pressure on the injured area. So when it has a pressure, it's actually stop the bleeding and also minimize the swelling area. Okay, so the next one is the elevation. All right, so the elevation. Elevate the injured area above the level of the heart, result in decrease in bleeding and swelling. So the injured part, particularly an extremity, alright, should be elevated to eliminate the effect of gravity on blood pooling in the extremity. So just imagine you injured your legs, alright, you injured your leg. Just imagine this is your leg. So if you just put your leg without any elevate, just slightly above, I have slightly above elevation. So the blood will not travel to the uh, your body, the injured part will not receive any blood. All right. So actually, if you have elevate just slightly above your heart, yes, it can allow the fluid or the blood system to go smoothly. All right. So that's it for the vice treatment. So if you guys have any question regarding the vice treatment, please feel free to ask me. Right. So the next one, yes, the thing that you cannot do in the first 72 hours immediately following the injury, which is harm. All right. So harm stands for H is heat. So if you suffer the injury in the first 72 hours, please do not apply any heat treatment. I don't care. Maybe you put the heats. The heat pack maybe, or maybe anything that's yes, like the skincare routine which is heat. No, stop it, because when you apply the heat treatment on something that is swelling, it can actually increase the swelling area, because like I said earlier, when you swelling, the damaged part is actually feel slightly hot. So if heat made heat, yes, of course, it will increase the rate of swelling. Okay, the next one, alcohol. Yes, of course, when you have the injured area, please avoid drinking any alcohol, alright? Because when you drink the alcohol, it will increase our glucose level. So when our glucose level increase, yes, our bleeding also will increase. Alright? And the swelling also will increase. And the R stand for running. So avoid any other form or any other exercise your during injured in the first 72 hours. And last one, massage. Please remember, if you injured first, all right, so mostly this is a typical Malaysian people. Yes, you have you injured, you dislocate, and usually the local people say, oh yeah, go to massage with part one, go to massage with part one. He can help reduce the pain. Stop that, that's actually bullshit. So in the first 72 hours, don't massage the injured area, because like I said, when you injured first, yes, of course, our injured part will actually damage. Maybe we don't know, maybe the tissue, maybe the ligaments, and maybe if it's swelling, just imagine if you massage it, it will not reduce the pain, it will only increase the pain for you. Okay, I hope you guys clear on the humps. Alright, so we proceed with the techniques on how to treat the treatment. So basically in this area, okay, it's actually best to do the in face to face. Alright, so maybe after the Gawai holiday, we're going to have one session of physical class, and I will teach you on how to fix this maybe the common injuries that can occur. All right, but please bring the bandage and stuff all by yourself. Okay, I don't have enough supply. All right. So the first one, dressing. So it's actually defined as a sterilized covering for a wound that cover and touch the surface of the wound. So what is the purpose of dressing? Alright, so dressing is actually is to prevent the infection. Alright, so when you have the injured area, if you don't cover it with something, of course, all the bacteria will infect the injured area. Besides, dressing also can help control the bleeding. Just imagine, alright, if you damage your uh, forearm, alright, you don't have any dressing, alright, or any pressure. Yes, the blood will keep flow up, alright. So dressing actually help to uh, absorb the blood and also apply the pressure, and it also will help to immobilize the wound area. On, so how to apply the dressing? Alright, so dressing. The larger than the wound, so that if extend beyond all the edge of the wound. So if it's larger, or what, it's maybe larger than my forearm here, yes, you can apply the dressing. If you have just a small cut here, please stop apply the dressing. Just use the plaster or something like that. So, softening and compressible so that it provides even pressure over the direct surface of the wound. Yes, the dressing that you may use must be soft and thick. Alright, soft but thick. Don't use the hard material because it will actually hurt uh, when you tie the knot of the dressing. Alright, so actually most dressing also porous, which allow the air to circulate to the wound and promote the faster healing process. Right, so the next one, yes, I hope, of course, I'm sure that you guys have already heard this one. The bandage, the classic stuff that we use to treat any injuries, even in sport or even in the. So the function of dressing, the function of bandage is actually it hold a dressing in the place over a wound. So basically, bandage is actually the first area. Alright, the first area. Dressing is actually the first area to cover the part, and bandage is actually the the stuff that actually to hold the dressing in place. So it's like husband and wife. So the first one is the wife. All right, the wife. She take care of the wound. Just imagine the wound is actually your son. So the wife take care of his sons, and then but the wife doesn't have enough support. That's when the husband come in. Alright, the husband come in and give a big hug to the dressing, to the wife, and also to the son. Just imagine the wound is the son, the wife is the dressing is the wife, and also the husband is the bandage. So all three of them will hug together. Alright, so reduce the pressure and hold the dressing. Alright, so it actually will reduce the pain, control the blood, and also promote for the healing process to be smoothly. Alright. So bandage, alright, properly applied and well secured bandage. Yes, like I said earlier, it promotes healing, prevents severe complication, or prevent any serious injuries. But please bear in mind, never place a bandage directly on the wound, as the bandage are usually non-sterilized. Alright, use a bandage only to cover a dressing. Yes, of course. The dressing area usually been sterilized by the hot water or something like that, but the bandage never been sterilized. It's actually a plain uh, maybe a plain material without being sterilized. So please don't apply it directly on the skin or in the injured area because we don't know because it not be sterilized. Yes, maybe something can affect the wound if you apply it directly. Okay. So standard triangular bandage, that is cut diagonally from a square of the 6 to 7 inches. Of course, the bandage have many types. Alright, so the first one is the triangular bandage. This is the triangular one, like the freaking Illuminati sign. Alright, so the triangular bandage mostly common use to support the fracture and dislocation. Let's apply the spin and form a sling. Alright, the sling is the when for example, yes, when you have a broken arm and the bandage support you, like your arm being hanging, that's the sling. And also make a improvised tourniquet. So in an emergency, you can make a triangular bandage from a clean handkerchief, a cotton towel, or a clean piece of sheet. So usually, please keep in mind, if you see someone who maybe have injured or broken arm and you don't have a specific bandage, don't worry. You can use anything that is clean to use as the bandage or to make a sling. For example, you can see your shirts, alright, but you must be creative in the specific area. Alright, you must have a good critical thinking at the critical moment. Alright. So this is the example of the triangular bandage. I don't need to explain all about the side, so that's not really important actually. So, but yeah, let me explain a little bit. So the triangle shape. So the top one is actually the apex, and the both left and right side is actually the tails. All right. So this is the triangular bandage on uh, how to make a cravat. Okay. But this one I will explain further during our physical class. And it's how you apply the bandage for the heads. Yes, for the elbow, for the wrist, for the shoulder, for the forearm, and also for the. I'm not sure the second picture, maybe for the eye or something like that. I never see that. As this is for the ankles, our knees, and also our knees and our ankle. Okay. So The mistake that occur when we bandage, yes, first one is the bandage is too loose and the bandage is too tight. If it's too loose, yes, it doesn't put enough pressure on the injured area and it cannot hold the dressing properly, which is doesn't have, yeah, it's not good, right? Because it might actually lead to the injured part to be exposed. As for the bandage being too tightly, so when you tie something too tightly, it actually put too much pressure on the injured area and it actually stop the blood flow from making the injured part, which is can cause a serious injury. So make sure your bandage firm enough to hold the dressing in place, but not so tight, because they can restrict the circulation, like I said earlier. And if you want to see the sign, if the bandage is too tight, first one, when you apply the bandage, when you tie it, please ask your patient or your athlete, maybe something like, is it too tight or is it too loose? All right, so keep communicate with them if they're conscious. All right, and now never cover the finger or toes with the bandage. Alright, this to make sure that the blood circulation occur at our injured at our fingers, unless the finger or toes is injured. Okay, bandage sign if the bandage is too tight. Yes, this is the sign. Alright, like I explained earlier. Yes, the skin or the bandage become pale. Of course, this is too tight, pale or bluish. It's a sign that the the blood did not flow. The bluish thing near the finger or toe, the victim complete of and of course the skin of the bandage is cold, and this is the list. Okay, let's go through it. Yes. Yes, the knot. Yes, tie the knot. So this is the technique, but I will show you later in the physical class. And this is how you apply the bandage for the shoulder, for our backs, for our this is technique actually for our shoulder. Okay, and this is for the head, for the eye, and also for our for our forehead as well. This is for the wrist, for our broken hands, and for our broken wrist, or maybe the burn wrist. Yes, this is for our knees and for our calf. And last one, we proceed with the splinting. So splinting defined as any device used to immobilize or to maybe to prevent a movement in a fracture or dislocation. So if someone suffer a fracture or maybe a dislocation of any body areas, uh, keep in mind that the broken area cannot be moved. So what you must do, you must apply splinting. So splinting, you can use any device, but it must be soft and rigid, and commercially manufactured or improvised from any object. Alright, if you don't have any specific or proper splinting, just improvise using anything that can that maybe the area can provide. Right? So the purpose of splinting, yes, of course, when you have the broken or the fracture or dislocation, all right, we must support and immobilize the fracture dislocation area. Uh, this is actually to help us control the bleeding, control the pain, and prevent further damage. Alright, that's what splitting is important. Keep in mind that splitting help to immobilize the fracture areas or dislocation. The rules and principle of splinting. Alright, yes, of course. Like I said earlier, the first one in the injured area, we put the dressing on any open wound. Alright, do you guys remember the open wound? We have 6 open wound. Okay, from the last lesson class. Spin the injured area in position in which it's found. Make sure the spin immobilizes the area and does not prevent any movement. Make sure when you spin the fracture areas, make sure the injured part cannot be moved. Okay, and immobilize the joint above and below the site of injury, and never straighten a fracture or dislocation of spine, elbow, wrist, or hip. If the fracture area, maybe the hand maybe slightly bent, please don't straighten it by yourself. Just apply the splinting, okay? And apply the cold pack to reduce the pain as well, okay? So this is the splinting that can be improvised. As you can see in the picture, it use the sticks, okay? That sample for the broken legs. This is also the material that I use for sprinting. Alright, the hazard of improper sprinting. Yes, if you use not a proper equipment that maybe is not suitable, it can compress the nerve tissue, blood, and blood vessel under the spleen. Delay the transport of victim who has life-threatening injury and reduce the distal circulation. This is the example of the sprinting using the cardboard, using the pillow. This is using the newspaper, which is unique, right? and this is using the woods. All right, so that's all for me. Thank you so much for joining. And please, if you have any question, please ask me in the Google Classroom or can directly WhatsApp me. All right, that's all for me. Thank you so much, and please have a good preparation for your sport carnival. So that's all for me. Assalamualaikum.